I think I will start with some housekeeping rules as people trickle in. Welcome everyone. Just before we begin, could I request all our panelists to keep all their devices on silent, and while they are not speaking, if you could please have your microphones on mute. And request to the audience, if you have any comments or questions, please pop it into the Q&A box and we will make sure to get to it at the end of the session. Hello, my name is Amu and I work with the Initiative for What Works to advance women and girls in the economy, and it is my pleasure to welcome you to this afternoon session of the gLOCAL Evaluation Week 2022. The panel is being co-convened by IWAGE, which is the Initiative for What Works to advance women and girls in the economy, as well as the International Center for Research on Women, ICRW, to throw light on challenges, learnings, and adaptations of doing research with innovative programs through innovative methodologies. Before we begin the actual session, I would like to give you a brief overview about IWAGE and the SWAYAM program through which this research has come about. The Initiative for What Works to advance women and girls in the economy aims to build on existing research and generate new evidence to inform and facilitate a gender and women's economic empowerment. We endeavor to shift the evidence base from how to what works, to improve women's participation in economic activities by addressing barriers to women's work, facilitating women's access to decent work and economic resources, and enhancing women's agency by leveraging the transformative potentials of women's empowerment collectives. IWAGE is an initiative of LEAD, an action-oriented research center at the IFMR Society, and is supported by the Bill and Melinda Gates Foundation. The Strengthening Women's Institutions for Agency and Empowerment, also known as the SWAYAM program, is a large-scale women's empowerment program housed within IWAGE. IWAGE through SWAYAM provides technical assistance on all gender programming to the National Rural Livelihood Mission, as well as conducts research to evaluate gender programs. SWAYAM launched in 2019 with pilots in 4 states, Chhattisgarh, Jharkhand, Madhya Pradesh, and Odisha. And the program in the states was led by civil society organizations in collaboration with the State Rural Livelihood Mission for each state. The pilots focused on 2 main strategies of gender perspective building through community trainings, as well as the establishment of gender resource centers. The pilots established a foundation for gender programming at the national level. And seeing the need for such work and motivation of the states to take up this work, the National Rural Livelihood Mission is scaling up this program to all 29 states. During the second phase of work, SWAYAM will intensify and expand its work with CSO partners in its 4 original pilot states, while initiating work on gender through our national technical assistance in all the other states. It is within this larger context that the Gender Justice Program, being led by Anandi and the Madhya Pradesh State Rural Livelihood Mission, is situated. The International Center for Research on Women partnered with Anandi to study the program and the processes implemented for gender programming. Today, we will see how this research was undertaken and the innovative methodologies employed by ICRW to conduct this research at the height of COVID. Today, we have with us Dr. Nilanjana Sengupta, who is currently Associate Professor at the School of Development at the Azim Premji University. Before this, she was working at ICRW, where she led this particular piece of research on the Gender Justice Program in Madhya Pradesh. Nilanjana has been working for nearly 2 decades on issues of livelihoods, labor, financial inclusion, poverty, and women's community institutions. In conversation with Nilanjana will be Radhika Uppal, who is a technical specialist at ICRW. She has worked for the last 6 years with national and international organizations on issues of livelihoods, economic empowerment, and health through a gender intersectional lens. She has years of experience in research, monitoring and evaluation, knowledge management, and resource mobilization. And with that, I will hand it over to Radhika for a short presentation on their research before we get into our panel discussion. Thank you.
Thank you, Amu. And a very good afternoon, everyone. It is indeed a pleasure to share our research methodology and the key adaptations with you all today. Before we begin with the adaptations, we wanted to share a brief presentation on the Gender Justice Program and our research objectives to just contextualize these adaptations and changes better. Next slide, please. Can we move to the, yeah, thank you. So as Ammu just shared, the Gender Justice Program is part of the largest YM program, and it was being piloted by Anandi in collaboration with the Madhya Pradesh State Rural Livelihoods Mission. It was implemented in 2 blocks, the Shiopur block and Karhal block of Shiopur district of Madhya Pradesh in 2019 and 2021. ICRW was the knowledge partner in this program. ICRW conducted a formative research at the beginning of the GJP, and the formative research we conducted was conducted in person, and we did it in Shiopur, Bhopal, and Delhi. This was followed by the next phase of the study, which was the process documentation of the strategies and outcomes of the GJP, which we did in 2020-2021. So this particular presentation will focus on the research methodology of the process documentation phase. So as we said, as the GJP was situated in the larger Mpsrlm structure, we wanted to briefly present that structure to you. So as you can see on the left-hand side, at the national level, we have the National Mission Management Unit. At the state level, we have the State Mission Management Unit, and the Mpsrlm is situated here. Then we have the DMMU, which is the District Mission Management Unit at the district level, where we had the Shiopur district team working with us. And the last is the Block Mission Management Unit working at the block levels of Shiopur and Karhal. Now the DMMU and the BMMU team are responsible for monitoring and supervising the work of the community institutions that you see on your right hand side. So in that structure, as you can see at the bottom, we have the self-help groups. So each SHG comprises of 10 to 15 women. Now these SHGs then federate into the level of village organizations or VOs. So each VO comprises of roughly 10 to 15 SHGs. Then VOs federate at the level of cluster level federations at the block level, and each CLF has roughly 40 to 50 VOs. Now at the level of SHG, you will see that we have a gender point person. Now the gender point person is responsible for carrying out discussions on gender and social issues at the level of the SHG. At the VO level, we have an SAC, which is called a Social Action Committee. The SAC committee is also there at the level of the CLF, and the mandate of the SAC committees is to do discussions and also conduct action on social and gender issues at these 2 levels. Then we have the community resource persons or the CRPs and gender CRPs in Mpsrlm. So CRPs within Mpsrlm are based on different thematics. So you will have a CRP for agriculture, for livelihoods. Similarly, we have a CRP for gender, and that's called as Samta Sakhis in MP. And the Samta Sakhis work across the 3 levels of CLF, VO, and SHG, and their mandate is to conduct trainings, conduct discussions, enable social action on all issues around women's rights and entitlements. Moving on to the next slide, please. Yeah, so now as we've seen what is the larger structure within which the GJP was situated, we also wanted to briefly touch upon some of the key strategies of the GJP. So it worked at 3 levels. It worked at the level of systems, it worked at the level of community institutions, and it also worked at the level of individual community leaders. So the first strategy is of gender mainstreaming, which is to mainstream gender at the level of systems and policies, so that gender responsive mechanisms such as guidelines, monitoring frameworks can be institutionalized and sustained. The second is institutional strengthening, which is strengthen and make women's community institutions more gender responsive so that they can set their own agenda, they can take action and claim rights and entitlements by negotiating with stakeholders and institutional actors across different levels, at the level of the village, at the level of block, at the district level, etc. The last pillar is feminist leadership development, which is to develop capacities of individual women community leaders, that is the Samta Sakhis or the gender CRPs, so that they can lead and sustain social change. Moving on to the next slide. Now, given that these were some of our program strategies, the process documentation was an exploratory study to understand and analyze that what are these strategies and processes through which rural women are empowered to claim rights and entitlements by exercising their voice through different platforms, different institutions, and agency, which is their own capacity to reflect, decide, and act. Now, we had 3 key research questions. The first question was that what are the strategies and processes that are required to mainstream gender in the institution building, capacity building pillar and existing structures of the rural livelihoods mission at different levels, at the level of, at the national level, at the state level, at the district level, and at the block level. The second was that what are the strategies and processes that are required to strengthen women's community institutions, and the primary focus was on the cluster level federations. So how these CLFs can be strengthened so that they are able to lead, engage, represent, and carry out actions, enabling the rights and entitlements of rural women. The last question was on what are the strategies and processes that are required to build the capacities of community resource persons, mainly the Samta Sakhis or the gender CRPs, to emerge as community leaders who lead, facilitate, and support the work of these community institutions in advancing the rights and entitlements of rural women. Next slide, please. Thanks. So moving on to the methodology, our study was qualitative. We followed a qualitative primary research where some of our key research methods and activities included doing key informant interviews with NMMU staff, SMMU staff, Anandi, etc. We did focus group discussions with the district team of Mpsrlm, the block team of Mpsrlm, the office bearers of cluster level federation, the social action committee members at the level of the CLF. We conducted in-depth interviews with Samta Sakhis and the master trainers. I wanted to point out here that master trainers are the people who are very closely hand-holding the work of the Samta Sakhis on ground in Shiopur. Then we also did some online consultations, online participant observations, and in-person participant observation. The duration of the study was we started our data collection in January of 2020 and we collected it up to September of 2021. And the geographical scope was Shiopur and Karhal blocks of the Shiopur district of Madhya Pradesh. However, I just wanted to also point out that we were able to go to the field and conduct a few in-person activities during January and February of 2020, subsequent to which, when the pandemic hit, we had to move all our activities into remote methods. So due to COVID-19, we have made some adjustments to the study to better understand and adjust to this new reality that the pandemic put us in. And it was also a good learning experience for us also in terms of how to conduct a remote research. So now I would like to hand it back to Amu to take this conversation forward. Over to you, Amu.
Thank you, Radhika. And could I please request you, Anila? Thank you. Thank you for situating your research and what we were trying to do with this kind of qualitative methodologies. And I understand it would have been very difficult to shift in such a sudden manner to remote methods of data collection. So I'd really like to start with you, Nilanjana, as you led this piece of work. What were the adaptations in your research design? What was the design thinking about how to go about these adaptations as you moved into remote data collection so it would respond to the needs of the kind of research that you were conducting? Nilanjana, you're on mute.
So sorry, can you hear me now? Yeah. Okay, first of all, thank you, Amu, and it's such an exciting moment to be able to share some of the learnings of how to conduct research in this really, really difficult and unique situation. I'd like to begin by saying that, during this March, April of 2020, we were facing multiple levels of challenges. So one, of course, the pandemic hit, and as a result of that, we went into a national level lockdown. So there were major mobility restrictions. So actually going to the field was out of question. So that was one level of adjustment that we had to immediately make. The second was we didn't even really know when the situation is going to change. So while, so if you recall in India, when we were having the national lockdown, initially it was about 21 days. Then we thought, okay, another 21 days, okay, another 21 days, but it went on happening. And then there was this whole fear of the second wave hit. So there was a series of uncertainty and a series of waves that were coming, which were also making it difficult for us to understand when we can recommence the in-person field work. So that uncertainty also added to this whole baggage of, how do we adapt? How do we change? The third and a very critical factor was that this COVID-19 pandemic was impacting everyone. So if we talk about the research participants on the ground, which Radhika have talked about, be it the Samata Sakhis, be it the cluster level federation members, the social action committee members, whoever we were going to talk to, they were also reeling under the health crisis as well as the economic crisis. So it was important at this moment to also rethink some of some of the questions that we wanted to ask. Because if you see that we were looking at a program which was supposed to respond to needs of women on the ground, needs of rural women. So right now, these women were facing a very, very different kind of crisis. And so how did that program as a whole respond to that crisis also became a very important line of inquiry. So somewhere the research questions themselves had to undergo certain kinds of change. So these were multiple situations that, multiple concerns that we were actually dealing with at that moment. And in response, there were multiple things we did. First of all, as you know, that all research goes through an ethical review board process. And if you are moving from, let's say, an in-person research to a remote method of research, we have to go through the IRB, the Institutional Review Board. And in fact, we went through 2 rounds of IRB, because initially we moved certain parts of the research to, to a remote method, to a telephonic or online method. But gradually, as it became clearer and clearer to us that we will probably not be able to go back to the field, in person, then we moved all the activities to the remote mode. So that was one level of effort that we were going through. The second is, many of the research activities, the way we would conduct them, that had to change. So for example, a lot of our research methods, as you've just now seen, were about doing, focus group discussions. And focus group discussions are typically 8 to 10 people in a particular group. But having a focus group discussion telephonically and managing a group of 8 to 10 people is actually a huge challenge, which we'll discuss maybe later in the conversation. So one of our immediate responses was try and have more one-to-one interviews, like shift some of these focus. I mean, if it is possible, change the design so that we can have more of key informant interviews and in-depth interviews rather than focus group discussions. And where we definitely needed focus group discussions, what we did is we broke it down to smaller groups. So we would now have, say, a telephonic focus group discussion with 3 to 4 people, or maximum 4 to 5 people. So in this way, also sometimes what we did was, because we were not there on the ground to build that, initial understanding and facilitate in that very active way. So sometimes what we would do is we'd take an in-depth interview for a certain amount of time and then maybe come back for another round of interview with the same person, because there would be certain new thoughts, certain reflections, certain questions leading from the first interview that would then go into the second interview. So these were multiple things that we were doing. And yeah, I think I will stop here for a moment. There were many, the way when we started executing on the ground, there were multiple other dimensions, especially coordination. And maybe in later we can talk more about it.
Thank you, Nilanjana. Actually, keeping the same train of thought, I'd like to move to you, Radhika. And as we've heard so much from Nilanjana about the changes within research design, how did that actually translate into your data collection protocols? How did the implementation of this research design, how did that happen on the ground as things kept changing?
Thank you, Amu. And yeah, I think it's a very pertinent question, because we made a lot of changes, as Nilanjana said, in our design, in our tools, in our guides. So how did we then move it into the ground? So for us, the first step, once these guides were also ready and we had got our approval from the IRB boards, was to then organize these research activities. So the first, for some participants, we did direct recruitment. So for instance, if we were speaking to participants at the level of NMMU or with Mpsrlm staff, we could do direct recruitments through ourselves also. And what helped us in that process was actually, because as I said, our formative research was done in person. So we had met a lot of these research participants. We've had a relationship. We did have a rapport with them because we'd met them in the past. So we could reach out to them to do the study for the, like to request them for time for the process documentation phase of the study. So that helped us. Having said that, for participants that were based out of Shirpur, we had to take help from the local field team that we had. So we had support of the partner organization team, which were physically present in Shiopur. And we also had the block team in Shiopur present. So we could sort of take their help in approaching these research participants. So the kind of process that we followed basically was, so for instance, we took the project team's help in approaching the Samta Sakhis for conducting a focus group discussion. Now, in that situation, the project team member would go and approach and ask the Samta Sakhi whether you would like to participate in this kind of research. This is the background. And if she consents to give the ICRW research team her contact details and agreed to participate, then we would call and we would explain to her about the study in much details. And then we sort of asked her for her informed consent and move forward. So we followed all ethical principles around informed consent, even when the partner organization were approaching. Having said this, however, the coordination that had to go in, so that's what even Nilanjana was sort of referring to. The coordination bit took us a lot of time. We were coordinating with the block teams for some activities, for some organizations, for organizing certain bits, and we were also coordinating with the project team for certain things. And even when we are coordinating these things, we had to be very mindful of the COVID realities. So that's again what even Nilanjana said, we had to be mindful that it's a health crisis, it's also a large food security crisis that people were feeling on ground. So we had to be careful with that, and that did, so we were sort of being very mindful of even all those field realities while we were organizing these activities. So on a normal time when we were in field and we were able to do this by ourselves, it would take say a week or 2 weeks to schedule most of these activities, which now took us about 3 weeks, 4 weeks also at some point. And we ensured that we are able to do at least 3 rounds of follow-ups with them. And even when we were following up, what really helped us, again, the field team presence really helped us, because we could ask the field team that if you're, because field team is present physically, right, in Shiopur. So they are meeting these participants in CLF meetings, they are meeting these participants during other project activity meetings. So while we are conducting a telephonic follow-up, they could also remind them that there is this activity that's coming up. So for us, I think that relationship that and the rapport that we were also able to build with the project team on ground, with the block teams on ground, through the in-person interactions we've had with them during our formative research, helped in this phase of the study as well. Because then through them we could approach. So their on-field support was very critical for us in that matter in organizing these activities. So I'll stop here for now.
Thank you, Radhika. That was actually, it's very interesting to see how things pan out on the field, especially what are the kind of enablers that you need when you are doing remote research and how that actually extends. Nilanjana, I'd actually like to move back to you in terms of what you were saying earlier in terms of challenges, because this does say there are so many challenges that one has to face. So maybe taking kind of a bird's eye view, what are the kind of challenges that you faced while you were altering your research, and maybe some of the key challenges that you really faced during this phase of work?
Thank you, Amo. I think that's a very pertinent question. But before I deep dive into the challenges, I would just like to mention one other point on the issue of how we adapted our design. And I wanted to say that another very critical thing about research design is how adaptable it is, how flexible it is. So given the COVID-19 situation, it's not only, the issue is not that we only changed, say, the number of FGDs we did or the size of the FGD groups, etc. Our interview guides, our FGD guides also went through a lot of change. And sometimes, and that brings me to the challenge also, we were also asking people questions about how they were dealing with the COVID situation, what kind of relief measures were being made available, how the Samta Sakhis were enabling people to access some of these relief measures, what kind of situation was there actually on the ground. So some of these questions were also being asked at a time when people were actually going through these processes, which have their own ethical challenges. And of course, when we are going through the IRB process, we were also taking care of some of these. And maybe at some other point, we can discuss some of the ethical challenges that we were actually negotiating and trying to deal with. But coming back to the question of the overall set of challenges, I think Radhika spoke very eloquently on the issue of coordination. I think one very, very important issue is when you are actually sitting somewhere else. We were sitting in Delhi, in Kolkata, in other parts of the country, and we were trying to do a remote research, which was located in a way in Madhya Pradesh. While definitely the project team and other people with whom we had built rapport, government officials, block level teams, all of them were extremely helpful, extremely cooperative. At the same time, there were really there was a lot of follow-ups that we had to do. A lot of time and energy had to be invested in this entire process, right? And despite all of that, what would happen is sometimes there would be last minute dropouts. Sometimes, for example, there was a situation when one of the local teams, they are supposed to actually come to a meeting, get the women together for an FGD, for a telephonic FGD, and that person fell ill and could not really visit that location. Right, so that day we had to actually not hold the telephonic FGD. There was another time when a senior government official came to the field on a moment's notice, and everything then. I mean, no one was available at that point of time. So also we understand that, because we had been to the field a couple of times or 2-3 times before, we had certain relationships with certain people. And that definitely helped. That prior rapport actually helped. But there were also a number of we were actually talking to a number of stakeholders, and with many of them, we hadn't really ever spoken before. So actually negotiating that distance between the researcher and the researched, if that itself was also a difficult process, especially in the context of remote research. In fact, as a result of that, there were certain activities which we had to drop. For example, we had planned some of these, interviews with beneficiaries of social action. So these are people who were helped by the Samata Sakhis to achieve certain entitlements and rights. But since we had no familiarity with these people and they did not know us, also these women did not have access to telephones or to any digital technology, and they were not comfortable talking to some strange women somewhere out there whom they had never met. So we had to actually drop that. Finally, we had to drop that activity. Again, we had thought about talking to certain kinds of government officials, and that did not come about because the coordination itself was so difficult. So in certain cases, we were able to coordinate with the help of the local teams because of our prior familiarity, but also because of our lack of presence in the field. There were certain activities which really could not be coordinated in that way. Also, as you know, at any point of time, an FGD facilitation is a very skilled process, right? But again, in a remote situation, when you're talking to even say 4 to 5 people, there were challenges of, how do you ensure that everybody participates in that? We all know that every group usually will have somebody, 1 or 2 people who are the dominant voices, who speak, others remain quiet. So we were facing those challenges only, but being in a remote location and doing this, telephonically, added or compounded those difficulties. Also, there were problems of what we call prompting. And maybe Radhika will talk about it, in the next round of discussion we have. But sometimes what would happen is because there would be, even when we were telephonically holding this FGD, we could hear sometimes somebody prompting from behind. So how do you deal with these situations? How do you then ensure that they have a free and safe space to actually air their views and their opinions and their voices? So these were certain challenges which became compounded in this online telephonic sort of a situation. We also, obviously, technology is a problem even for us. Sometimes our internet doesn't work and all of that. And imagine that situation where many of them do not have smartphones. Some of the women do not own phones at all. So they are dependent on phones of their husbands, their fathers, their brothers, or their sons. In that case, reaching them itself was a challenge. So I recall a situation when it was we wanted to have an interview with this person, and we are calling. Her husband has the phone, and he says, "Okay, I am out. I'll come back after an hour, and I will connect you to her." And somehow we never. I mean, that day we could not finally connect to that person. From that to a situation of call drops when we had to again call back, and somewhere there is no connectivity. So all of these issues, these technical issues, were also problematic. And let's also note that we are talking about a country where most of the rural women do not have that kind of digital literacy, who do not have that kind of access to smartphones. So somewhere, again, I mean, if we had a Zoom meeting in which we were conducting an FGD, it might have been still better. We could have seen people, the people would have been visible, but we were trying to do a telephonic FGD in a space where sometimes connectivity would be an issue. So I will stop here. I mean, I could go on and on about challenges, but let's take it again further during the discussion.
Thank you, Nilanjana. And I think that is actually the added layer of complexity. Doing remote research is already a complex process. But then when you mix remote research with very rural areas of this country, specifically with poor women who have very limited access to digital technology, that just compounds the problem. But you have to work with it because we were in such a situation. And I'm actually going to pull from something that you said earlier as well when I turned to Radhika. And ethics has been a concern in terms of, just as Nilanjana was saying, in terms of privacy, who is prompting. So ethical considerations is something that has been talked about and has been written about. How did you face the challenge of ethical considerations specifically?
Yeah, thanks, Amu. And so ethical considerations is something which has been a challenge even in in-person research. And we always have to ensure that we have our mitigation measures in place. And as Nilanjana said, that way for us also, the IRB processes enabled us to think through how in a remote research setting, we'll be able to deal with some of these ethical challenges. So one of the ethical challenges we faced was around privacy during the in-depth interviews itself. So how do you, when you're meeting somebody physically, you are able to create that environment where there's nobody around her, she's in a more safer space, she can sort of very frankly speak about her experiences. But this is a remote research, we are connecting with her telephonically. So how do we ensure that? So some of the ways we tried to sort of mitigate this kind of a risk was that we always used to first ask the participant that what's the time, what's the date that suits you the most. We always used to also brief her a bit about what the discussion is going to focus on. So she can actually take an informed call of what time suits her best, where on what day suits her best, which location suits her best. Does she want to take it from her home? Does she want to take it from the CLF office? So she has that choice of picking the location, the date and time completely based on these considerations, because this is going to be the line of discussion. So that was one part of it. However, while we were actually conducting these IDIs, we were also being very mindful of the fact that if suddenly we hear noises around her or we hear her responding to somebody, we used to stop and check with her that should we continue this conversation or should we postpone it to another day and time. So we always ensure that she's in a comfortable, safe space and we can move it to another day completely if she feels that now she can't take this conversation any further. The second consideration or the second challenge that we faced was around, as even Nilanjana had mentioned in the beginning, and I was also talking about the entire situation of COVID-19 and holding a research in a pandemic and asking a participant to take out time when the participant is actually going through a lot of crisis with herself, with her family, in her own surroundings. So how do you manage some of that? Like, for instance, we remember when the second wave hit in April, May of 2021, we had stalled all our research activities. Even then we were doing it remotely, but we stopped all the activities because we understood it's not fair to ask a participant to give us time at that point of time. So we only reconvened all our research activities once the pandemic situation had stabilized. And we also consulted, because we had a local organization that was in Shiopur. So we consulted them that is it a right time to start the research again, or would you suggest us to wait some more time and then we can restart it? So we did that. The third issue was around sensitivity. So how Nilanjana was also talking about sensitive questions, and a woman talking about personal experiences, and she's talking to you over the phone. Sometimes she's talking from, she's taking this call from her house. So how do you ensure that she's still being able to deal with some of these things? So some of what we always did was we ensured that when we are scheduling these activities, we are scheduling this in consultation with the local organization. We inform them that we will be conducting this in-depth interview. At any given point, if the research participant, we felt that the research participants going through a distress, we used to stop. We never probed beyond a certain point if we feel that the woman is uncomfortable. And even when you're on phone, there are non-verbal cues you can pick. You can pick pauses, you can pick hesitancy. So those are things you have to be alert about also when you're talking to them. So when you pick these things and you understand, then we never sort of moved forward if we felt that the woman is feeling uncomfortable with a certain line of discussion. And if we feel that she's under a lot of distress, we knew that we have a local partner organization to then call on and say that, could you please support her? So that was another thing. Another challenge that we faced, which again, Nilanjana was sort of hinting towards, is around prompts. So the reason this whole thing happened, and that's a challenge that we faced in a remote research, was because as she mentioned, all women in rural areas do not have access to mobile phones. So sometimes we depended on the Samta Sakhis to sort of use their mobile phones to connect us with the group. So for instance, if we were holding a FGD with the CLF SSC members. Now SSC members all SSC members may not have phone that day, or they may not have phone at all. So in that situation, we were dependent on the Samta Sakhis to connect us with them. So now in that situation, the Samta Sakhi is present there, and you can hear prompts. So what do you do at that point of time? Of course, we did try and sort of engage more with the other participants. So you remember their names, you remember that these are the SSC members, and you try and sort of relate to them or engage in a discussion with them. But there is a point till which you'll be able to do it, and I'm being very frank about it. So for us, the measure to ensure that the data quality is not affected or our insights and our analysis is not affected was to triangulate the data from different sources. Because we did an extensive qualitative interview with multiple sources, we were able to triangulate our data when we were arriving at a finding. So that helped us. The last point that I would like to mention is, so Nilanjana pointed towards the gendered access to technology and its logistical challenges associated with it. But that also has its own ethical challenges. So if a woman does not want to, is not comfortable telling her husband or her son that she's talking to an external person, or she's not comfortable holding these conversations in front of her, then how do you manage those? Because I mean, she sometimes, as Nilanjana was also mentioning, sometimes these are the phones of the husbands or the sons. This is not her individual phone. Then how do you sort of work around it? So again, the two things that really helped us was that we told her that this is the kind of questions we'll be asking. You can pick whatever date, time you want to do it, early morning, you want to do it late evening. You can choose, and this is the kind of question, so you can decide that what time suits you the best. The other way also was that because the local organization also had their own office, like physical office in Shiopur. Similarly, each CLF has its own physical office. So women can choose. We had given them the option to also choose wherever they want to sort of take this call from. And in our IRB, we had also sort of made a provision of covering their transportation cost in case they are moving out of their houses. So it's not an extra financial burden on them in case they choose to take it from any other place. So some of these things also were ways in which we tried to mitigate some of the ethical challenges that we were facing. I'll stop here for now. I think I've exceeded my time.
That's okay. And as I am cognizant to time, I would like to open it up to the audience who is here if they have any questions. And as you think, maybe I just throw out to both Radhika and Nilanjana, maybe if you'd like to tell us maybe one key learning that you had through this entire process. And I will let you know if we have any questions as we move on.
So shall I go?
Absolutely.
Yeah. So, I mean, I think there are many learnings, but I think one very key takeaway from this entire shift to a remote method is that remote methods would work best in the particular context that we are talking about, where we are actually doing research with rural women in India. I think what really has been very critical to the success in a way of this entire research is the fact that there was a set of people out there on the field. So there was a network, there was a prior rapport that was built, and there was a local not a local organization, but they had the local team working there. So even if as researchers we were not there in the field, there were some other people who could help in that entire coordination. I still do not know if that hadn't been the case, what are the other challenges we would have had to face. I think coordination would actually have been a nightmare. So having this sort of a prior rapport, building those networks with local organizations, people on the ground actually who are still there at that moment, these are very critical to ensuring that your remote research can work well. I'll stop here.
Thank you, Radhika.
Yeah, I think I completely agree with what Nilanjana said. The presence of the on-field team and these rapport that we had built was very, very useful for us. I think the other learning that we also took from this was the importance of having a more flexible and dynamic research design so that that can adapt to these changes. So you, of course, always keep your research questions, your objectives as your North Star that's guiding you, but your research design needs to be flexible enough to account for these external factors that are happening. And a lot of these things you don't have control over. And for us also, like, we created a flexible work plan. We created bigger buffers when we were creating our work plans to ensure that it's not impacting timelines a lot. So you have to keep this thing in mind, because as I think both of us have extensively said, that coordination takes a lot of time when you're trying to do remote research. These were some of the things, some of the key learnings or takeaways for us. I'll stop here.
Thank you. That was, so maybe just as a last, as we are quite on time, it is just does pertain to research design, Nilanjana, the question. So I will move it to you. Are there some things you feel you could have done better in terms of research design? That's the question. So is there anything you feel that you could have done in this entire process that would have, in hindsight now, hindsight is always 2020, that would have?
So, see, I think what I really missed during that entire remote research process is actually participant observation or even non-participant observation. Initially, when we had created a research design, I think this participant observation was a very key input into the entire research design. So that was another research activity that we were going to follow. So we wanted to sit in all of these CLF meetings, the Cluster Level Federation meetings. We wanted to sit in the VO meetings. We, of course, were going to be part of senior government meetings. And we were going to sit in every month, the Samta Sakhis had their review reflection meetings. So we wanted to be part of these meetings. Now, because of online research, this participant observation component became pretty limited, right? So we were able to do it in the first 2 months of January and February. But after that, we obviously, since we were not going to the field, and in fact, for the research participants themselves, till about July, for them also, they were not holding any in-person meetings till about July or August of 2020. But even after they started meeting gradually, because there were mobility restrictions for us all, it was difficult to start. I mean, we were still not going to travel from one state to the other and all of these issues. So we couldn't really be part of these meetings. However, what is interesting is, especially when actually even in Shiopur, when the meetings were still not happening in person, some of the Samta Sakhis were being part of what we call huddle calls. So all the Samta Sakhis together would actually have a monthly conference call to discuss many of the things. So we were actually listening in those calls. We were also being part of some of the project meetings, and we were listening in, participating. We were also definitely part of all the government meetings, whether with Mpsrlm or with NRLM, and these have given us great insights for our research. But if you say on hindsight, I think one of the things that I have really missed is being part of that that participant observation, which could have been possible had COVID-19 not happened. Yeah, but again, on the flip side, if you see that remote research also enabled us to do certain things which otherwise we couldn't have done. So because right now so for example, we could go back to a person for another round of interview. You know that whoever is conducting field research, we have limitations of financial resources, time, and etc. Right? Because right now there were no financial resource implications like that. So if there were last minute changes in the schedule, if people didn't, like I told you about that government official who visited at the last moment, and we had to those 2-3 days we could not really hold any interviews or FGDs. Now, had we been there in the field, this would have been really, really challenging. We all go with a certain limited amount of time. So we go for a week, and out of that week, let's say if 2-3 days people are not available, then that really impacts our research negatively. But because it was a remote method, it was also possible to reschedule very quickly, to go back to the person, another time, if that was convenient for that person. So some of these were also gains of remote research, I would say. Radhika, do you want to add to that?
Yeah, very quickly, if you want to, 30 seconds add to that, please go ahead.
No, I completely agree with that. I think what Nilanjana said is very true in terms of the participant observations, because we were also planning to sort of shadow the women in the field, the Samta Sakhis, when we were as part of our original research design. So we really wanted to see their journey up close in front, see them in government offices, see them with their families, see how that change has happened over a period of time. So that was something which, of course, in person we couldn't do, and we felt that that would have been a great sort of addition. But again, as we moved into the remote research methods, of course, we could at least reach out to her over multiple rounds. So we had time to reflect back on the findings of the first round, analyze it, think through it, and then have another round of interview, which may not have been possible if we were doing it in person. So yeah, I'll stop here.
Thank you so much, Radhika and Nilanjana. It's been a pleasure being in conversation with you. And thank you everyone for listening in into this afternoon session. Yes, hope you all have a great evening ahead. Thank you.
Thank you.
Thank you.